Good morning, good afternoon, good evening, and welcome to another episode of Something About Surgery. Today we want to talk about things you should look out for if you have had abdominal surgery. And this is going to be a rapid fire session with 10 things that you should be on the watch out if you have had surgery, or if you know someone who has had surgery and they have been released from the hospital. Number one, starting at the wound site, any swelling of the wound. If the wound starts swelling or that area starts swelling, then we think about a blood clot accumulation, or what we call a hematoma. We think about infection with pus accumulation. We think about maybe some repair giving way deep, and therefore some contents of the abdominal cavity popping out, maybe bowel or some other organ, what is called a hernia. So it is important that if you notice there's swelling that wasn't there after you've been discharged, that you quickly seek surgical intervention. Number two is discharge from the wound, be it pus, be it some fluid, be it some blood. It is important that this is given attention by the surgeon to understand why that is happening, because when you're discharged, usually your wound should be repaired, it should be watertight, it should be dry, unless the surgeon has specifically left the wound open and told you to be going for serial wound dressing on a day-to-day basis, which we can do in certain instances, especially where we think those wounds are very dirty to be closed primarily. Number three, you should look out for the wound gaping or giving way, when this skin tears apart, and then you can look at the deep layers of that wound site, and in some instances the entire skin and the underlying layer of muscle called fascia gives way and intestines pop out. That is catastrophic and painful to look at. That is something you need to bring to your attention of your surgeon. Number four is pain. Whether pain is worsening at the surgical site or in your abdomen or in any other part of the body, pain should be going down when you're discharged. You are discharged on medication, and therefore if pain is going up, then it means there is something that is developing. Number four is distension of the abdomen. Again, something to be concerned for, because you want to understand, is there constipation? Why is this person distending? Is there a perforation of the intestines? Why is this person distending? And so many other things that can develop. So abdominal distension is something to be worried about. Number six is vomiting. Vomiting is dangerous. Most of the patients will feel nausea and vomiting immediately after surgery, especially because of the effects of the medications we use for general anesthesia. And as a result, what we do is, of course, give pain medication that can counter that effect, that nausea and vomiting. However, when you are discharged from the hospital, you may be discharged with some nausea medication, depending on what painkillers you're discharged with. But if now you're discharged and you're off medication, and then you start developing these complaints and you're vomiting, that is a serious development, and we should be able to bring it to the attention of the surgeon. Then number seven is diarrhea, especially that type where the patient goes to the toilet, they're expecting to see a lot of stuff coming out, but nothing comes out, just some mucus, some water, and they just feel like they can't completely empty, but there's nothing coming out. That is a sign that there's infection in the abdomen that is settling down in the pelvis. That causes what we call irritative diarrhea. If that happens, please get back to your surgeon for review. Then if you develop panting and racing of the heart rate, we call it tachycardia in medical lingua. That is an indication that either you could be bleeding and therefore your blood level is low, your blood pressure is low, you could be infected and therefore you are septic. It could be because of the pain, it could be because of many other complications, but a racing heartbeat is one of the indicators that things are not well. Then hotness of the body, which again is an indicator that the patient could be having sepsis, could be having another complication that is serious enough to be attended to. So if you feel that your body is hot, you can't dress warmly, you are sweating, it is important that you seek urgent medical intervention. Then chest or calf pain. Chest or pain behind your leg. Chest pain or pain behind your leg. This is a huge scare for any healthcare provider, because we know if you develop that, we feel you could be having a blood clot in your leg veins that can easily travel to the chest and cause significant blockage of the chest. This complicates 3 out of every 10 patients who get surgery of the abdomen. It is important that those are quickly reviewed and the necessary scans or examination done to rule out anything dangerous. So quickly to recap what you've said, the 10 things that anyone should be on the watch out for once they have been discharged from hospital after abdominal surgery include swelling of the wound, discharge from the wound, gaping of the wound, pain at the surgical site or generally in the abdomen, distension of the abdomen, vomiting, diarrhea, panting or racing heart rate, hotness of the body, and chest and calf pain.